Hello guys, this is Vamshi Krishna. Welcome to my YouTube channel. Today we will see some of the multiple choice questions from the respiratory system. So these questions are basic and important questions for upcoming staff nurse recruitment examinations. So the first question is, it is really interesting question, that is pneumano ultra microscopic silicono volcanocoisis. This is nothing but pneumano ultra microscopic silico volcano coniosis. This is the longest word in the English. So is a disease is caused due to. So among these four options, which option is responsible for the, otherwise it's a cause for the this disease? Options are grain dust, volcanosilicon dust, sugarcane dust, cotton dust. The right one is option B. So option B is a volcanosilicon dust. It is a cause for the pneumano ultramicroscopic silico volcanoconosis. The next one is epistaxis is a condition patient the advisable position. So when the patient is having epistaxis is, options are bleeding from gums in sitting position. So in this question we have the two questions, okay? Option B, bleeding nose in supine position. Option C, nose from bleeding head down position. Option D, bleeding from mouth head down position. So the right one is option C. So bleeding from the nose, and the patient has to sit in head down position. Okay, so this is the position for the patient when he is having epistaxis. Epistaxis is nothing but bleeding from the nose. The next one is, what is the total lung capacity of person in 25 years of age? So understand the question. What is the total lung capacity of the person in 25 years of age? Options are 600 ml, 1600 ml, 6000 ml and 2000 ml. So the right one is option C. So option C is the 6000 ml of total lung capacity of person in 25 years of age. So this is 6000 ml is nothing but 6 liters. So the next question is the length of trachea. Options are 10 inches, 5 inches, 12 inches, 16 inches. The right one is 5 inches. So 5 inches of the length of the trachea, it's a normal length of the trachea, that is 5 inches. The next one is, what is the purpose of surfactant and where it can be used? Options are in stomach and lower the surface area. Option B, in lungs and prevent the collapse. Option C, in trachea to breathe air. Option D, in pleural cavity. So the right one is option B. So surfactant is used for the in lungs to prevent the collapse, and it reduces the surface area of the alveoli. The next one is the most common post-operative complication is. So post-operative is nothing but the patient is come after the surgery. Options are bronchiectasis, atelectasis, emphysema, COPD. The right one is option B, atelectasis. It is a most common post-operative complication of a patient. It is due to the anesthetic effect of the drug. The next one is circulatory emboli is a complication of. So when the emboli is present in the circulatory system is nothing but cardiovascular system, that is in blood. So what is the complication? Options are gastritis, pulmonary embolism, pulmonary stenosis, lung collapse. The right one is option B, pulmonary embolism. So the circulatory emboli it's finally sedimented in the lungs, so it is cause for the pulmonary embolism. The next one is failed chest is seen in, okay, flail chest is seen in. Options are vertebral fracture, rib fracture, sternal fracture, ribs fracture. The right one is option B, ribs. Okay, it is plural, it is singular. So option B is the ribs fracture. So more than the one ribs are fractured in the thorax, it is called flail chest. So here you can see the picture. In the picture we have the multiple ribs fractures. So it is called flail chest. The next one is pneumonia can be caused due to. Options are bacteria, virus, fungi, chemicals, all of the above. So the right one is option A, all of the above. So pneumonia can caused by the bacteria, viruses and fungus and some of the chemicals. The next one is postal drainage can be done in how many positions? Okay, postal drainage is nothing but removing of secretions from the lungs, that is a postal drainage. So in how many positions we can do the postal drainage? Options are 10, option B 18, option C 9, option D 15. So the right one is option B 18. Why? Because total 18 segments are present in both lungs. So to remove the mucus or secretions from the segments, we need to do the postal drainage in 18 positions. The next one is identify the picture below shown. So the picture you are seeing, this is a oxygen mask. So what is the name of this mask? Options are nasal cannula, option B nebulization mask, option C Venturi mask, option D rebreather mask. So the right one is option C, Venturi mask. So this is the Venturi mask. It is not a simple oxygen mask. It is a Venturi mask. So by this mask we can give the 45 to 50% of oxygen for the patient. The next one is which drug is cause for the asthma? Options are morphine, aspirin, cyclopam, tetracycline. The right one is option B, aspirin. For the prolonged usage of aspirin, it can cause for the bronchial asthma. The next one is trachea is lined with which type of epithelium? Options are stratified epithelium, simple squamous epithelium, ciliated epithelium, pseudo-stratified columnar epithelium. So the right one is option D. Pseudo-stratified columnar epithelium is present in the trachea and ciliated epithelium is present in the pharynx and larynx, mainly in the nose. The next one is normal pulmonary artery pressure is. So what is the normal pulmonary artery pressure? Options are 10 mm of Hg, option B 10 to 20 mm of Hg, option C 1 to 15 mm of Hg, option D 20 mm of Hg. So the right one is option B, 10 to 20 mm of Hg. So during the exercise, this pulmonary artery pressure can be increased up to the 25 mm of Hg. The next one is atelectasis is characterized by. Options are slow deep respiration, diminished breath sounds, a dry unproductive cough, rapid short respirations. So the right character is diminished breath sounds we can see in the patient with the atelectasis. Atelectasis is nothing but collapse of the lung alveoli. The next one is Mantox test can be sensitive for. So what is the purpose of doing Mantox test. Options are AIDS, herpes, leprosy, tuberculosis. The right one is a tuberculosis. To find out the antigen in the body, in the human body, we can do the Mantox test. That is a whether it is a presence of tuberculosis in the patient. The next one is relaxation of internal intercostal muscles are causes. Options are inspiration, expression, breathing, none of the above. So the right one is inspiration. So during the inspiration, the internal intercostal muscles are relaxed. Okay. So during the expiration, external intercostal muscles are relaxed. The next one is normal inspiration expiration time ratio in rest. Okay. So during the rest time, what is the normal inspiration and expiration rate? Options are 1 is to 1, option B 2 is to 1, option C 2 is to 2, option D 1 is to 2. The right one is option D. 1 is to 2 is the normal inspiration and expiration time ratio. That is in rest. The next one is CO2. CO2 is nothing but carbon dioxide carries in blood in the form of. Options are plasma, hemoglobin, bicarbonate, lactate. So the right one is bicarbonate. So in the form of bicarbonate in the blood of CO2. The next one is early signs and symptoms of dyspnea. Options are cyanosis, restlessness, convulsions, altered level of consciousness. So the right one is restlessness. So when the person is having restlessness, this is the early signs and symptoms of dyspnea. The next one is emergency of acute asthmatic attack. So when the person is having the acute asthmatic attack, what we need to use the which drug can be used in emergency acute asthmatic attack? Options are adrenaline, betamethasone, hydrocortisone, cetirizine. The right one is adrenaline. So adrenaline can be used in the case of acute asthmatic attack. The last question is what is ET tube suctioning time? So what is the normal endotracheal tube suctioning? Options are 5 seconds, 10 seconds, 15 seconds, 20 seconds. The right one is 10 seconds. So within 10 seconds we have to do the endotracheal tube suctioning.